Good morning and welcome to KCHC Pulse, Kinston Community Health Center's podcast for patient education. This is Carrie Brinson. She is a case manager at Kinston Community Health Center and a registered nurse, and she's been with us for 13 years. And I'm Tracy Ziegler, the Director of Health Informatics and Information Management. This morning, we're going to talk about annual wellness visits. So, Carrie, what is an annual wellness visit?
So, an annual wellness visit is a yearly appointment with your primary care doctor to create a preventative plan.
Okay, so who qualifies for an annual wellness visit?
Patients who have Medicare Part B.
Okay, so are there different types of annual wellness visits?
Yes, there are different types. Medicare Part B it pays for covers a initial or welcome to Medicare, a first, and a subsequent.
So, what is the difference between the three?
So when you first get Medicare Part B, that is your initial welcome to Medicare, and you get that. You have 12 months to get that annual or welcome to Medicare visit, and then after that, you have the 12 months after the welcome is called the first, and then after that is a subsequent.
So, if I just turned 65 and I've got Medicare, I would get the initial?
If you're 65 and you just got Medicare, you would get the initial, yes, in the
Okay.
first 12 months of getting Medicare Part B.
All right.
Yes.
And so then if I didn't get it in that 12 months and I'm 67 years old, then what do I get?
You
Did I
would
just lose my opportunity?
No, you would still be able to qualify for the first annual wellness visit.
Okay. Okay. And what about people who are younger than 65 who are on Medicare for various reasons? What do they get have the same process?
It's the same process.
Okay,
Exactly.
so if I were 37 and chronic conditions and ended up having to be on Medicare at 37 years old, I would get my initial within that first 12 months,
You would get the first,
even though I'm
I'm
not
sorry, yes, you
65.
would get the initial, even though you weren't 65. Age isn't necessarily the factor for Medicare. So patients or recipients who do have Medicare Part B would still qualify for the initial in the first 12 months, and then the first after the 12 months, and then subsequent each year after.
Okay, all right. So then what's the difference between an annual wellness visit and an annual physical?
Oh, so Medicare Part B unfortunately does not cover the cost of a physical, only the cost of an annual wellness visit. So the difference is if a patient came in and requested a physical, it would be an out of pocket cost.
Okay, so the doctor's not going to listen to me or check my foot or, look at my ears.
So it's a hands off visit. This is preventative, and what we're doing differently in this visit is asking questions for prevention.
Okay. Okay. So, can I get an annual physical anyway?
You could, but it would cost you out of pocket.
So I would have to pay for the annual physical, but not the annual wellness visit.
Correct.
Okay. So when I go to my physical, I can get my lab work done. Can I get my lab work done at my annual wellness visit?
Not at the annual wellness visit. We don't cover labs in this particular visit, but at your next follow up for your chronic condition, certainly, yes.
Okay. So how often can a patient get an annual wellness visit?
So the annual wellness visit is yearly. So if you happen to get Medicare in the middle of the year and you came to us in the middle of the year, it would be 12 months from that time frame.
Okay. So if I've got it in November of last year,
Mm-hmm.
it's the new year. Can I get it then?
You can get it in November.
In November. So I can't, just because it's a new year in January, February, I can't get it again.
Correct.
Okay, so 365 days.
That's right.
All right, so when I have an annual wellness visit and I've got chronic conditions such as diabetes, hypertension, something that along that line, will you address those things along with the prevention, or is it just the prevention?
So it's just the prevention at that time. We like to make sure that we're only addressing the prevention part. So the provider will actually do more advice, education, and referrals at that point. When you come back for your follow up visit, he'll address, or he or she will address the chronic condition.
Okay, so what other topics will be talked about? Just prevention?
So prevention, but we'll make sure that first we want to make sure we have the height, weight, and your vitals and in your chart. We want to make sure that we're discussing any type of injury risk or fall risk. That's important to know based on getting a baseline for that. And then we're going to discuss diet, especially if you have chronic conditions, specific diet, and your fall risk, I think I said, and then your ADLs, which those are activities of daily living. So, how you are getting dressed, how you are bathing, getting yourself together, maybe cooking and cleaning and things like that. Medications is really important to us. We want to make sure that we have all your medications listed from all your different providers. And then, of course, how your memory is. It's important that we understand how each patient is doing cognitively. And then we want to make sure we do a depression screening.
So what if I'm taking some other medicine from a cardiologist? Do I need to bring that in too?
It's very important to us that you bring in your other medications from any other provider that you may have.
Okay. So what kind of preventive exams would be recommended?
Well, there's a lot of preventive exams that are recommended based on your chronic conditions, but the most important ones for a lot of patients, based on their age, there could be different ones, but I think most patients are familiar with the cancer screening ones for males and females. So we're going to look at age factors for mammograms. We're going to look at colon cancer screening referrals. We're going to look at depression screenings, I think I said. And then, of course, if depending on the age, pap smears. And then, of course, low lung cancer screenings based on patients' smoking history. And we could have some cardiovascular screenings that we may need to do. But a lot of that is going to come from the information we gather based on their chronic conditions.
Okay. So are some of those services offered in-house or at the center, or do I need to go somewhere else for those?
So with our colon cancer screening, we do offer two different types. One of them is the Cologuard. So the patient can get those and sent to their home, and they can do those on their own. And based on their risk, they may have to opt for the colonoscopy, which of course would be sent to a specialist for that. The mammograms, of course, would be referred out. And then some of the other screenings, yes, they are done in-house.
But Medicare covers those?
Medicare would cover them, yes.
Okay, so I don't have to worry about that.
No.
Is there anything else that patients or people with Medicare would need to know about an annual wellness visit?
One of the most important things is really knowing your family history. It's important that patients know, so first and second line medical histories of their families. There's a lot of chronic conditions that do run first and second line. I think people are familiar with diabetes, hypertension. There's some cancers that do run in families, so it's important that we have that information so that we do make sure we are screening those patients. Which is part of the prevention. We want to make sure that those patients get the correct labs and referrals and things like that. And then, of course, the medications are really important. We want them to bring in even over-the-counter medicines. There's supplements out there that patients are taking, and maybe some things online that they've seen, and it's important that we know all about that.
One other question. Are hearing and vision screenings done?
Yes, a lot of times it's not a specific hearing screening, but while we're talking to the patient, we can identify whether or not there is any type of fluctuation in the patient's hearing. And then, of course, if we know that there is some issues going on with the patient's eyes, we have resources and we have testing for that, yes.
Okay. Well, I appreciate you spending this time with me and teaching me and patients about annual wellness visits. It sounds like it's a really important process and thing for patients to take advantage of.
Yes, it is. It's important that you get those screenings done, and it's important that you come in each year to have them completed.
All right. Well, we thank you for joining us for this episode of KCHC Pulse. We hope you have learned a lot about annual wellness visits, and make sure you schedule your annual wellness visit if you have Medicare Part B. Thank you.
Thank you.